I'm Grace McComsey, professor of pediatrics and medicine at Rainbow Babies and Children Hospital in Cleveland, Ohio. The focus of my research is HIV, in particular comorbidities like cardiovascular disease and bone loss in HIV-infected kids and adults. Yeah, we have a lot going on actually in the area of HIV at our site, and you know, the one area now that's making HIV-infected kids vulnerable, if you will, is comorbidities. And what that means is, although they're living, they're taking medications, their viral load is undetectable, they are suffering from a lot of comorbidities. A couple of these are focuses for our research. One is osteoporosis, and the other one is cardiovascular disease. And we were the first site to lead a 4-year prospective study looking at progression of carotid IMT thickening, which is a marker of early cardiovascular disease. So it's an easy ultrasound-based test that you can monitor vascular damage in these kids with HIV. And what we found so far, we presented that data at several meetings, is that these HIV-infected kids, despite being good citizens, taking their medications, have an undetectable viral load, they have very abnormal vessels. So they are at risk of having very early cardiovascular disease. So we followed them and we're looking at mechanisms, meaning why do they have this premature cardiovascular disease? And so far, we've made some interesting observations, which were very interesting because they simulate exactly what adult studies have shown, is that enhanced inflammation is the reason for why they're at higher risk. So even though they're taking medications, they're undetectable, they have heightened inflammation, which cause the vessels to age. So even if they're 10 years of age, their vessels look more like 20, 25, 30 years of age. So we're looking at ways now we're doing further research to try to understand what exactly is wrong in their inflammation and immune system. And thus, what can we do? How can we prevent that? Or what can we do to treat this heightened inflammation, to decrease it? We've done several studies, actually, to try to elucidate that. We used fish oil, very prescription brand fish oil. We used vitamin D supplementation in kids with low vitamin D because outside of HIV, there's a lot of data that vitamin D can affect positively the immune system. So we looked at even supplementing with vitamin D. We looked at salicylate, which is a form of aspirin, but you can give much more of it to affect inflammation. And so far, all our studies led to negative results, meaning although we conducted it in a very well-designed studies, the results showed that these anti-inflammatory agents have no effect on cardiovascular disease in HIV. So now we moved one step higher and we're trying other agents like statins, which are known to have anti-inflammatory effect in adults, but they have not been studied in kids. So we're designing, along with collaborations with Emory and other sites in the US, we're designing studies looking at statins to decrease cardiovascular risk in HIV-infected kids. So kids and young adults up to 25 years of age. So there's a lot going on in that area, and at the same time, by modulating inflammation, you can decrease the risk of bone loss. And we showed that actually in some of the adult studies. We're trying to duplicate it in the kids studies. Because a lot of our kids, even though we've had a 9-year-old who had a fracture, something that you don't see frequently in a normal 9-year-old, a 9-year-old HIV-infected kid was cheerleading and had a minimal trauma led to a significant fracture. So all these complications are really affecting the quality of life of our patients. So that's why our research is focusing to try to make their life better, that even though they have the virus, they're taking medication, we really want them to live a almost normal life beside having to take medications and come to see us.